Healthcare reform, it is a project that has bedeviled administrations for years now. The Clinton administration back in '93, '94 got in real trouble in trying to reform the healthcare system in this country. That was an effort headed up by Hillary Clinton, as you might remember. Now President Obama got a bit of good news this morning from a group of healthcare providers, groups like the American Medical Association, the pharmaceutical manufacturers, and so forth. They have promised to squeeze $2 trillion out of future health care increases by increasing efficiencies. Can they deliver? Well, that is the $2 trillion question. Let's talk about it now with Michael Cannon, Director of Health Policy Studies at the Cato Institute. Elizabeth Carpenter is the Associate Policy Director of the Health Policy Program at the New America Foundation. Elizabeth, first of all, this is I don't want to say smoke and mirrors, but what they are saying is that if health care costs are projected to go up this much in the next 10 years, these groups, the American Medical Association and others, they're promising to shrink those increases by about 1.5% per year. I have that right?
You do. You do.
$2 trillion overall if they can deliver, but there are a lot of ifs.
Well, I mean, certainly I think we should remain positive about this, because this really is a vast departure from the way these groups approached healthcare reform in the early 90s. And I think the important thing here is that this really should give lawmakers some confidence that we can cover everyone in a fiscally responsible way. Look, we know that about 1/3 of what we spend on healthcare in this country does not add clinical value, does not make patients healthier. And these groups that historically have said that they're not in favor of some of the reforms that we know that will add value and control costs, are now not only saying bring it on, they're saying we're going to help you do it. So I think there's nothing really negative about this. We should be positive about it.
Well, Michael, you're at the Cato Institute, a group that likes free market reforms. The fact that these are a bunch of, industry organizations promising to cut health care costs, you must like that proposal.
Well, remember, these are lobbyists that are promising to cut health care costs. And Elizabeth was correct when she said that this is a vast departure. In fact, I think it's a little too vast a departure. When do you ever hear lobbyists saying, hey, we want to reduce revenue for our members? There's something fishy going on here. And look at what the president wants to do is he wants to cover all of the uninsured. That costs close to $2 trillion over the next 10 years. To come up with that money, he's got to either tax people or he's got to cut payments to healthcare providers. He's floated some ideas for doing both. The providers have pushed back, and even members of his own party have pushed back against his proposed tax increases. So one thing that could be going on here is Congress has been sort of leaning on the Congressional Budget Office to assume some savings in some of the proposals that they want to put into health care reform. So if they get the industry to help lean on the Congressional Budget Office too, well, then maybe that'll put more pressure on the CBO to cook the books. If this seems too good to be true, that industry lobbyists are saying we want less revenue for our members, it probably is too good to be true.
Yeah, it is a complicated question, obviously. Michael, Elizabeth, we're going to have to leave it there. We'll continue to watch this as these new policy formulations on health care move on in the days ahead. Thank you both.